Dr. Elgammal is a postdoc fellow at the Division of Trauma and Surgical Critical Care, Department of Surgery at the NJ Medical School, and she's going to be discussing her funded research. So go ahead, Dr. Elgammal.
Thank you so much, Angela. Good afternoon, good Friday afternoon, everyone. I really appreciate you lasting through this very last breakout session. And I thank the Rutgers New Jersey Gun Violence Research Center, as well as the Research Day programming staff, for inviting myself and really my mentor, Dr. Stephanie Bonney. As Angela said, I am a postdoctoral fellow at the New Jersey Medical School in Rutgers. I've had the privilege of working with Dr. Stephanie Bonney, who's a trauma surgeon and a trauma medical director at the University Hospital of Newark, really since 2017 when I was a student. My current research focuses on hospital-based violence intervention programs, and I focus on identifying risk factors of gun violence victims and survivors. The research findings of which I hope to share with you all today. I'm also a student at the School of Public Health at Rutgers. I'm currently trying to finish my MPH in epidemiology, and on my spare time, I'm a surgery resident at NJMS. I have no disclosures to discuss for either of the two studies that I'll be sharing with you all today. So prior to the publication of the 2020 data on injuries and fatalities that came out in April of 2022, the leading cause of injury and injury-related deaths among children and adolescents were automobile collisions. And since the CDC published this 2020 data, the firearm-related mortality is now the leading cause of death among children and adolescents. Specifically, we talk about ages 1 through 19 years. Younger children are more likely to be injured or killed by a firearm in the home as a result of intimate partner violence or being intentionally shot by someone else as a bystander. The current existing research provides very little information linking firearm violence against children with their mistreatment. And by mistreatment in this context, we really mean physical abuse or neglect, emotional abuse or neglect. And as such, we aim to investigate a variety of risk factors among the rising trend of firearm violence against children and adolescents. Specifically, we wanted to understand the context by which these children were becoming victims, hypothesizing that only a few of the pediatric gunshot wound victims that we see in the urban setting were evaluated for neglect, abuse, or other forms of mistreatment at their index injury, thereby making it difficult for us to employ reduction strategies as we saw fit. So for this study, we performed a retrospective chart review of the pediatric gunshot wounds that took place from 2014 to 2020 at a level 1 trauma center in New Jersey. We examined really the following variables. We looked at demographics, nutrition, whether they were undernourished, malnourished, or well-nourished, the intent of the gunshot wound. So we'll talk about the breakdown then, but essentially whether it was intentional as assault or unintentional as a legal form of intervention. The weapon that was used in that particular incident, whether there was suspicion of neglect as identified by the social worker who investigated the incident in the inpatient setting, the mode of transportation these victims were arrived at the trauma center, and the location of the gunshot wound, meaning where the actual exchange took place. The information that we abstracted this information from the trauma history and physical, which is like the incoming chart that we develop as the patients get triaged, as well as the social work notes. It's no surprise to anyone who's been attending today's talks or really paying attention to the news in the last 20, 30 years, that the majority of the people of the 348 that we identified in these pediatric GSWs were male, were Black, non-Hispanic. A fifth of them were about under the age of 16 years, and 1% were under 8 years of age, which is, none of these numbers are really acceptable. 10% of these GSWs really occurred within the vicinity of the home. I'd like to point out that this 40% unknown is a recurring theme in some of the breakdown of our data that we're presenting to here. And it may be related not so much in the lack of the data, but the communication and interconnectivity between the data that's acquired from law enforcement and shared with emergency medical services. So we then explored a variety of those who had multiple GSWs, meaning their encounters they've had repeated encounters in the time frame that we investigated. Of those encounters, we found only 28 who had multiple GSW encounters, and they were on the older spectrum of those we investigated. Only 14% of them had a social work involved, and of those, only one had a documented suspicion of neglect. When we broke down and individually searched in each of these charts, the earliest encounter of violence any one of these pediatric victims was around 13 years old and had a subsequent gunshot wound at 17 years of age. It's obviously no surprise to anyone that over half of the intent identified was assault. Of note, this 0% self-harm is really just an N of one person who had used the handgun with the intent of self-harm, and it really speaks to the broader picture of the pediatric versus adult population victimization of gunshot wounds. So we then explored a variety of the social factors associated with these pediatric GSWs. Although abuse and neglect were really identified in 4% of these patients, only a third of them had adequate nutrition. Again, a majority of these unknown perpetrators could be a problem because it's not about really actively identifying the assailant. It's just that the information that is solicited may not necessarily be shared across all people who could use that information. The takeaway from this is really no child should be shot, and a child with a history of exposure to violence has to be screened for some of these social factors. There are a lot of reasons why we should look more into how firearm injuries and fatalities rise among the pediatric population. And really, that rise has sustained over the past decade. We don't have enough of an assessment related to the environment and social determinants of gun violence. And from a clinical perspective, we can't sufficiently emphasize the need for early and outpatient evaluation for abuse and neglect in this vulnerable population, because it does remain critical in breaking the cycle of urban gun violence. So shifting the vulnerable population focus, the next study we'll discuss is on the identification of risk factors of women survivors and victims of firearm violence. The motivation behind this population focus was because of rising trends of intimate partner violence, which, although has skyrocketed since the start of the pandemic in 2020, was already on that rising trajectory well beforehand. We know that intimate partner violence is not the only cause of female firearm violence. Every month, there are 70 women who are shot and killed by an intimate partner. And women in the United States are 28 more times more likely to be killed with a gun than other women in high-income countries. So the goal of this study was to identify intimate partner versus non-intimate partner related injuries in order to facilitate violence reduction strategies. We investigated the trauma registry of 5 level 1 trauma centers across the nation from 2012 through 2016. And similar to the child adolescent study, the data we queried from the registry were intent, perpetrator, weapons used, mode of transportation to the emergency department, where the GSW occurred, social work evaluation. And in addition to this particular to this study, whether the patient had prior hospitalization as well as the reason for that hospital encounter. We acquired the national firearm deaths separated by sex through the CDC web-based injury statistics query and reporting system. And what we found is jarring on a couple levels. So the 7,300 GSWs we identified, 10% were females. Intent was about half of the time was related to assault, which is a pretty jarring number. And although 26% of female gunshot wounds occurred inside or around the home, only 5% of them were presumed to be IPV related. And we'll speak later as to why we think this is an undercounting rather than an underprevalence of intimate partner violence. This starts, the next few slides are showing a breakdown by year. So here we're comparing on a yearly basis the number of gunshot wounds between men and women. So clearly men are the predominant victims of gunshot wounds, and this is not surprising given the national data. But the case fatality rate is really astronomical when we compare males to females. It's about 85% for females and 74% males, and this was found to be statistically significant. We looked at in-hospital mortality, meaning the prevalence of gunshot victims who died after they were admitted to the hospitals, whether they got treated for their wounds, and in the light of being treated for their wounds. And the in-hospital mortality was also higher among women, about 12 versus 9%. This was also statistically significant. What about those who were dying before they even reached the hospital? Again, higher. 81% females who had gunshot wounds died compared to about 75%. Again, statistically significant. So the takeaway from this study was that even though a quarter of women were shot at home, the reported intimate partner violence was really low. Again, we're not attributing this to a lack of intimate partner violence among the remaining cohort, but rather we don't screen enough. There isn't enough reporting. Maybe some of it could be attributed to those who are dying before they get to the hospital. One of my favorite aphorisms to use, it's actually sometimes misused, and that the plural of anecdote is data. So the absence of a lot of the granular details of our studies carries consequences related to resource allocation and policy making, and really motivating those who are the movers and shakers in alleviating the gun violence epidemic. Some of the gender disparities specific to our studies could be attributed to more fatal injuries. Conversely, the anecdotal evidence is not adequate to prove something. And the data, these studies can help us with specifically hospital-based intervention programs targeted towards women victims of violence. And with that, I thank the New Jersey Gun Violence Research Center, the Research Day programming and planning staff for this opportunity to discuss our work. And I'm happy to take questions.
Thank you so much, Fatima, for taking the time to be with us today. That was an awesome presentation.